far. Because people say, what will the hospital do? The highest thing the hospital can do is to abandon them. Don't come here again. Where is your father? Where is your mother? Where is the man that impregnated you? If you cannot give a certified or true copy of the identity of this.
All right. I think Mrs. Zion missed the point today. You missed it. I'm not talking about the pregnancies. It could be anything. It could be anything beyond pregnancy. Someone could literally be walking on the road and get hit by a car. I mean, and people bring the person to the hospital, and then they leave. As soon as they're sure that the person is doing fine, they leave. And that person is saddled with responsibility of paying the hospital bills. Now, there are times when the person cannot pay. When somebody is dying, the person is not thinking of the hospital you are taking the person to. It's not that time the person is saying, don't take me to a private hospital. Private hospital is more expensive. Take me to a public hospital, please. At least, I can manage to pay. That's not what the person is thinking. Sometimes the person is unconscious. I have been at the hospital. I mean, in the months of, I think I was in the month of June, July. It's more like my entire family were hospitalized. Baby, me, chairman, all in the hospital. And as I was there, I had to be strong for every other person because I needed to see to eating, feeding, and other stuff. I saw a child that was rushed to the hospital, hit by a keke driver. And yes, the hospital had to do first aid. But because of things like this, the hospital was insistent on getting across to the child's parents. It was a boy. He was barely more than 12 years. Between 10 to 12 years. Thank God the boy could speak. Thank God the boy had his mother's phone number by heart. So he called the phone number. They called the mother. The mother came. And you know what the mother said? Let's go. They said, madam, this boy is... She said, let's go. There's no money for any further treatment. He'll be fine. They said, madam, we need to... She said, let's go. I understood why she said, let's go. Because any further treatment on him is more money that will be paid. It was a private hospital. So she knows her condition fully well. She looked at the keke driver. Yes, they seized his keke. She brought a police. But how much could come out from this keke driver? How much? So the best thing for them to do was to leave. And then she took him. And it didn't take how many minutes the boy passed out. And they had to bring him back to the hospital. Because the distance between that hospital and wherever hospital she thought was probably cheaper, or wherever chemist or pharmacy was far. And they had to arrange a room for the boy. And all she was thinking of was how to pay the bill. The hospital bill. You see, paracetamol. Paracetamol is not common paracetamol anymore. A card of paracetamol costs like how much? So the last time I bought it, how much was it? Paracetamol is not even cheap. I mean, that was the list drug. I mean, cheapest that anybody could possibly get for headache, for pain. But it's not even cheap. The hospital needs to run. Patients' lives needs to be preserved. Sometimes I'm sure the hospital management, they're in a dilemma between recuperating their funds or recovering their funds and preserving the lives of the patients that have come to them for care. So tell me, what should they do? Now back to this girl's story. The detained mother, who looked so frail and weak and carrying her 5-month-old baby in the hospital lobby on the top floor, revealed that there is no way she could have ever blamed the doctor, as he has really tried to bring her and her sick baby back to life. The man really tried for us, even without a deposit. He commenced treatment because I was brought in unconscious. She described both the doctor and the staff at the hospital as people with good hearts. So there are hospitals with good hearts. The doctor is a very good man. He has tried for me and my baby. But the truth is that my parents don't have money. That is why they abandoned me here. My mom is a petty granite hawker who lives in Ugeli and trades in nice Wari Delhi to hawk granules. And said the meager proceeds from her business was not even enough to feed the home. Why did her father, he did not have a job, and has since left Ugeli but didn't disclose where he traveled to. Now, someone asked about the father of the boy. They asked if Toyin's husband has put a call through to him, and she said she has not set eyes on any of them, except the first day Toyin was brought, and the only money deposited was after the surgery and was just about 60,000 naira. The owner of the hospital said, I do not run a charity organization here. I pay bills and we do buy all the items, oxygen, drugs, diesel, and pay for everything we use in treating patients. So why should they be treating me this way? What pains him the most is the fact that they send the girl and her baby feeding money even as she's here. But her parents and the people have refused to either call or even visit the hospital to sort out things. But because they felt I'm a small boy or a fool, they are not bothered. That's how the hospital owner is feeling. Or should he go out of business because someone cannot pay? Let's read some of your messages on Facebook. Udoka says, imagine if all these countries were collecting loan from cheaters the way we treat people who owes us in this country. What's this supposed to mean? I don't understand. This shows that we are in a frail country. We should stop celebrating government for doing rules. These are basic things. We have government, local government should be able to pay medical bills for the citizens in their locality. Beckel John says there are several important issues to consider when patients run up a balance. The most important thing to remember is that good clinical care must continue to be provided until the financial situation has been resolved or until the treatment relationship has been properly ended. To do otherwise will leave the physician vulnerable to allegations of abandonment. You see? So, the clinic or the hospital, they don't want to be held for abandoning patients that were brought to them. However, how are they going to recover the monies that these people owe? 0817 923 0002 0817 923 0003. Again, 0817 923 0002 and 0817 923 0003. A message on WhatsApp says, the state government should intervene. Emeka Jacob Elebiri. Yes, they would intervene. But is it for every patient? Don't you think people will start taking advantage of the fact that the state government will intervene and keep rushing to the hospitals, knowing fully well that they cannot afford the medical bills? We need to go on a commercial break. When we come back, the conversation continues. Send your messages to 0809 030 6416. We are Nigerian Info. best should hospitals and health centers handle patients' inability to pay medical bills? Beyond this girl, Tony, are several other patients who are not able to pay medical bills. So is it the hospital that will go looking for the governors or the local government chairman to come and pay the bills of their citizens?
You pass the message through radio now. I had the message. If I have the mind to give, I will not give to help. Not for the hospital, to help the patient to be out of the hospital and then recuperate at home. If the government has done the needful, it took it to them today. Someone that should have used to invest in other private sectors or help them to be in business. That's the money that's sponsoring. That's why they are buying the money from rugged vehicles for rugged roads. So they will have rugged things for rugged hospital also. So let him bring his money and fund people and then give the people also to can run their business smoothly. Thank you very much.
Okay, thank you. So let's assume I understand him. What he means is that let the government, but the government don't run those hospitals. I'm just saying. And even if you say, oh, the government should come up with free medical care, what's the sustainability?
Nigeria Info, the talk station of the
Welcome back to the sunny side. Unfortunately, I think we have barely 2 more minutes to round up this conversation as we have a live appearance. No, not a live appearance, a recorded program coming up by 1:10. So let's see if I can squeeze in one final call or maybe 2 final messages, and that will be all for this conversation, sadly. 0809 030 6416. WhatsApp and Telegram number 0809 030 6416. And the call line remains 0817 923 000. So if you're just joining us, welcome. If you've been with us, thank you for staying tuned to us. We're talking patients' inability to pay medical bills. And I did start off by saying that it seems like everybody owes, from owing house to shop rent to owing creditors to owing service providers, in this case healthcare service providers. The list goes on, and you see the recovery of money owed to a business seems harder than one can imagine. A particular girl, 18 years old, is owing a hospital 537,800 naira. She was brought into the hospital unconscious. They had to, get her back to life, and her baby and all of that. And afterwards, the parents and relatives that brought her to the hospital ran away. And the hospital has detained her for the past 5 months. And I am asking, how best should hospitals or health centers handle patients' inability to pay medical bills? So someone says you may share account number. I don't have an account number. And I don't have the account number. I'm not talking about this because I want us to raise funds for this girl. I'm talking about it because beyond raising funds for her today, what about other patients that may not be able to pay tomorrow? Do we continue raising funds to offset medical bills of patients who are unable to pay?
Whatever you post on social media, your screen time, what you search, what you browse, everything. You're saying that mobile